Welcome to Cottlehaven. We have a beautiful nursing home here on its own grounds. It's like being in the countryside, and yet it's only 1.5 miles from the city centre. We have assembled a wonderful team with the aim of providing contentment, care and comfort.
Cottlehaven Nursing Home is a purpose-built modern nursing home established since February of 2003. We have 60 residents living with us here at Cottlehaven at the moment. We in total have 56 bedrooms. 52 of those bedrooms are single bedrooms and all the bedrooms are en suite. And then we've 4 double bedrooms, be it for couples or whoever would like to share.
My name's Narina O'Brien and I'm the activity coordinator here in Cottlehaven. A lot of our ladies enjoy sewing as they get to do things like make their own pillowcases or blankets which personalise their bedrooms. It's also a chance to have a bit of a chat and a cup of tea with other women. One of our favourite activities here in the home would be bingo. A lot of residents enjoy bingo because it's a chance to be social with each other as well as winning prizes, and it can get very competitive. We really enjoy doing baking every couple of weeks as we get to make things like muffins and cakes. And one of our favourite recipes is the Guinness cake, and we all get to have a sample of that at tea time. Once a week we have Movie Thursday here in Cottlehaven. The films range from anything from a golden oldie to a new release. We show a different film every week, and while you're watching the film you get to have a cup of tea and a slice of cake, so it's well worth a visit. Our prayer group is mostly Catholic orientated. In the prayer group we have the Rosary. We also have the Stations of the Cross followed by Holy Communion. Every day we have our daily Gospel reading and we have the Saint of the Day. We also offer up our prayers for any special intentions that the resident may have or the families, as families are always invited to take part in the prayers. We also do beauty care, which is usually one-to-one. And in the beauty care, your skin just gets treated with some moisturiser and you get a full makeover. And by the end of it, you're left looking like you're one of the roses of Tralee. The ladies really enjoy this as it's a time just to chat with a staff member one-to-one, as well as getting a bit of well-deserved pampering. A couple of times a week, we have a visit from my dog Molly. She's being trained at the moment to be a therapy dog, so she's very gentle and very friendly, and she'll just sit up on your knee or down beside your legs and you can pet her and feed her and just get familiar with her. The benefit of having Molly here in the nursing home, unbeknownst to you, is that it will lower your blood pressure and it's also a calming form of interaction. She enjoys having the company herself, and she'll just be your best friend.
Food is very important to our residents here at Cottlehaven Nursing Home. We have 2 chefs, Siobhan and Ursula. They produce freshly baked bread, freshly cooked desserts, fresh made soup, and the dinners and the evening meals are baked fresh every day. Our food is locally sourced, it's local produce, and our suppliers are all certified and they're listed on our menus every day.
Food is a very important part of the residents' life here. They really enjoy all the home baking and the fresh soups and nice fresh dinners. I love baking every day. The residents love the fresh baked scones and the apple tarts, and it's what they were brought up on as well. And they always ask, like, when is she making the tart again, or when they should make the scones again, and they really appreciate it, and it's great to get the feedback from them.
Today we're serving poached fillet of cod with a herb and lemon crust, served with a white wine and dill sauce. We get our fish from Galway Bay Seafoods. We have a variety of fish that we serve. We got fillet of salmon, smoked haddock, baked cod, plaice and whiting.
We meet them on a daily basis so we can interact with them to see what their favourite foods are, their likes and their dislikes. We have a dietary sheet for each resident so that we can always look back on and find out what they do like or don't like. And they will always let you know. The feedback is great from them and they'll always let us know. Today we have a special birthday. It's Anne. We're doing a fresh sponge for her with fresh cream, decorated with fresh cream and strawberries. And we'll write her name and her age on top, and we'll bring it up and we'll put candles on it and we'll sing happy birthday to her, and we'll all blow out the candles and they'll have a big clap and a big cheer, and it's all great fun. We'll get a great kick out of it.
And at the end of this corridor we have a beautiful, specifically developed room for the hairdresser. We have 2 visiting hairdressers. They come on Monday and on Thursday, and it's an extremely sociable little room where we all get beautified and pampered.
I'm Patricia Boyer. I've been here for about 8 years and thoroughly enjoy the work and enjoy the people. I feel it's marvellous for them to have some relaxation in their week and have somebody different to talk to. We have a lovely salon here in Corralhaven, extremely well equipped with all the best equipment. I mainly do their hair. I was a beautician, but I now mainly do their hair, and that would be mostly all. They have their nails done here in the home and they have their feet done, their toes painted, so they're very well looked after. I might add a little lipstick and a scarf, and they have lots of parties. And they have a very, very nice ladies' day for the races. There are people with Alzheimer's that I work well with, and for 30 years I was in Merlin Park at various homes, and I'm very used to it. It doesn't faze me in any way, and it's difficult for the families, but patients are lovely. And I think regardless of how you're feeling, if you look nice, feel nice, and people are kind to you, it helps a tremendous amount.
Corralhaven has the services of a visiting physiotherapist, Kevin.
Some of the advantages of physiotherapy for residents of Corralhaven, improving their flexibility, improving their strength, maintaining mobility, so making sure that they're able to walk, making sure that the clients are able to perform their transfers like sit to stand, getting in and out of the chair, getting in and out of bed, up and down from the toilet, walking down the corridor, being able to walk around and meet other people in Corralhaven. Other things like improving circulation, making sure that they've good blood flow to their feet and their hands. Making sure that they're able to do things for themselves, being as independent as possible is one of the main goals of physiotherapy. I think physiotherapy certainly adds to the quality of life of the residents here in Corralhaven. We do an exercise class with a lot of the residents, and certainly they seem to get a lot of benefit out of that, and it's an area where they get to meet other clients in the rest home, and they get a lot of enjoyment, a lot of fun. We do a lot of games in the exercise classes, and there's a lot of laughter, a lot of joking, and it's not taken too seriously, so everyone seems to have a lot of fun. As well as, in terms of quality of life, being able to get out of your chair yourself and walk down to meet your friend who's 20 metres down the corridor is certainly a great benefit. Here in Coralhaven we use all of the different corridors and different rooms that we have available to do our physio and our exercises, because they're the areas and the locations that the clients will actually be using themselves. So, I exercise, we go for walks down the corridors that they will be walking in themselves during the day. We practice exercises in their bedrooms, such as getting on and off the chair, getting on and off the bed in the bedroom, because that's, at the end of the day, that's where they're going to spend some of their time, and it's good for the clients to be in a familiar environment so they know what to do when they're in that area. One of the aspects of physiotherapy here in Coralhaven is a posture assessment and a seating assessment. So it's very important to make sure that the person is sitting in the correct type of chair for them and sitting in the correct position. So I would assess that and make sure that they have, cushions and support in the correct places to reduce the chances of pressure sores and contractures and things like that. So making sure that they're most comfortable that they can be. The psychological benefits of physiotherapy are huge. Being able to set a target and being able to achieve that target is a great achievement, such as being able to walk 20 or 30 metres down the corridor. When someone achieves that goal and achieves that target, it brings great enjoyment and great benefit, and that follows on into everyday life. It gives them the confidence to be able to walk that distance every day. Perhaps being able to go for a walk outside might be a goal or a target for a client, and being able to achieve that and achieve it independently is a huge thing. It allows the residents and the clients to be able to get out of their environment, to get out of their rooms and to get out of the sitting rooms and to socialise with other people in Coralhaven, and being able to take a walk outside and get out into the fresh air is huge as well.
All our residents have the services of a GP. Most of our residents prefer to retain the services of the GP they had when they were living at home in the Galway area. If they cannot retain these services for whatever reason, Coralhaven has a visiting GP, Dr. Sean Higgins, who is available to take care of all their needs.
My name is Dr. Sean Higgins. I'm a GP here in Galway City, and I'm the resident GP here for Coralhaven. All new patients now admitted to Coralhaven come under my care and the care of my surgery. I visit Coralhaven once a week, and I see all patients here on a routine basis. Should there be any problems between that time, I can pop in any day of the week to review you, to liaise with your family, or to arrange any hospital admissions or referrals that are required. We can liaise with all other healthcare professionals here at Coralhaven, including your OT, physiotherapist, or any outside healthcare professional like your consultant or any other carer who you attend in Galway City or beyond. We can liaise with your GP to make sure that all medication is up to date. And after your stay here in Coralhaven, if you return to your GP, we can do a follow-up review, or we can provide any notes or correspondence required to your GP or consultant. As well as providing a weekly service to all patients here in Coralhaven, we also provide 24/7 cover through Weststock here, our out-of-hours GP co-op in Galway City. So as part of our service, we can provide and do attend family meetings. We can meet the next of kin or the extended family to discuss any aspect of the patient's care here at Coralhaven or with regards to any other healthcare facility here in Galway. These family meetings can take place here at Coralhaven during one of our regular reviews, or they can happen at our Tuam Road Surgery, Galway Primary Care.
My name is Dr. Audrey Kinahan, and I am the lead pharmacist from University Late Night Pharmacy, and we are involved in the provision of medicines and medication management system to Coralhaven Nursing Home. I would see that the pharmacy and the pharmacist liaises very much between the patient's nurse and the patient's GP in ensuring that the patient's medication always allows them to get the best care possible. This means that the pharmacy would actively communicate with the nurse on a daily basis, and we are open 364 days of the year, and we routinely communicate with the GP. It also means that we're able to ensure that as a patient's medical needs change, as happens routinely during their time within Corralhaven, that we can respond to these changes and ensure that they're always getting the best possible medical treatment. We can also ensure that when a patient is transferred from a hospital, that the transfer is seamless, because we would interact with the hospital team before the patient actually leaves the hospital to go to Corralhaven Nursing Home. We view ourselves as part of the team of healthcare professionals at Corralhaven Nursing Home, and the medicines that we supply are supplied in accordance with a robust quality assurance system where everything is documented, and pharmacists and nurses make regular checks all the way through the process, and everything is audited as we do our work. One of the most important areas where we feel as the pharmacy that we can assist the resident in Corralhaven is by actually meeting with them or with their family member to discuss any medicine or medicines related issue they might have. We are always available at any time within the pharmacy for a quick phone call.
At the end of this corridor then we have what we call the fountain area, which is our dedicated dementia unit. It's a beautiful area to come and live in. It's built in a circle, so our residents with dementia nice to travel around during the daytime, and it's very relaxing. It's built around a central fountain area, and when the fountain and the water is running during the daytime, it's extremely relaxing. We've a lot of natural light up in this area, so we've windows on all sides, so it's beautiful, it's bright, very well lit. The decor is very, very calming. Interspersed along the corridors then we've these lovely little seating areas with places and points of interest for the residents. So in one corner you might find some residents flicking through a photo album, be it of their choice or one that we have provided. In another area you have two more chairs with a radio in this corner, and some residents are sitting there listening to that. In another area we have our little budgie, and he keeps the residents entertained, and some of our clients just love to sit and listen to him tweeting away all day long.
Living here, well, I like it here. Well, I love people, and it's life is what you make it. You must mix with the people, whether you like it or not. And you do get on like me, unless you're an awful cranky person. There is a few cranky ones, all right, but they're generally all nice. They all help one another, and when we have things on, like Norina has things on, and we have the singing and all, it's lovely. The atmosphere really is nice. It's open and you can walk around and talk to people. I love making friends, and I cannot bear just hello and goodbye and keep going. And it's very important, because there's a lot of people very lonely, and you don't know when you start talking to them. You nearly cry with some of them, but you help them then, you know. But that's what I love mostly, the get-togetherness and going to things as we do, Noreen, and the singing and doing sewing and knitting and dancing and everything, and go to outings and all that. We do have that. But that's the most important thing. You're lost. You're lost if you don't get involved with people. And I love it when there are things on, and or if anyone enters anything, that the win or something, you enjoy that as well, you know. We do sewing, we do nice sewing and lovely knitting and crochet even, which is very good. And we do have a bit of dancing and all, and singing and choir singing. And Friday, Saturday, we have a mass here, and we sing part of the mass, and it's lovely.
At the end of this corridor we have a beautiful oratory which we are now standing in. Every Saturday this oratory is used for Mass, and a lot of visitors come, and it's a very popular event on the Saturdays. We cater for all denominations, all religions all together, so it's an oratory, it's not just specifically for the Roman Catholic religion.
So my name is Father Kevin Blade, and I'm the parish priest in the local parish, and Corralhaven Nursing Home is within the boundaries of the parish, and I come here once a week and any other time that I am needed throughout the week. So I would be on call 24/7. And we have Mass here every Saturday at 3 o'clock. Usually once a month we'll have the anointing of the sick. That would be a part of the Mass. We have confessions. Some of the residents were in parish choirs, and they love to sing, and they join in, they bring in their own hymn books, and they're well able to sing. Unfortunately, I'm not able to sing, but they make up for it. And then afterwards, if any of the residents or family members would like to meet me afterwards, I am available to meet them. And I'm also available for the staff as well, if they want to meet with me. From outside of the Mass, I give them as much time as they need, and I listen to them, and when they start talking, they are a great, they will come from different parts of Ireland, and I love listening to them and to listen to their story and listen to their aspirations and just to be there for them. From coming here for nearly 2 years, I would have got to know them personally. I would know them by their first names, and when I go to the rooms with one of the nurses or with one of the staff, and they would like me to stay longer, and they want me to talk with them and to listen to them. Some of them are very wise. You get all different age groups, and they have a lot of knowledge, and they like to share that knowledge, and I like to listen and to learn a little bit of history, and the history of Ireland and of the local areas that they would come from.
My name is Loretta O'Neill. I'm an independent volunteer advocate here at Coralhaven Nursing Home. Well, Coralhaven is a strong supporter of the National Advocacy Programme. Residents are held in high esteem, are shown great respect and courtesy, and are very much held at the core of everything that happens in this nursing home. You spend a lot of time initially getting to know people and building up a trusting relationship, so that eventually the deeper concerns that a resident might have can be aired on a one-to-one basis. Having somebody that they can turn to who is non-judgmental, who will take no issue with anything, who has no agenda, makes them feel more at ease and happier.
It's a beautiful nursing home. I love the feeling that it's so bright and airy, and it's a lovely spacious nursing home. It was one of the things that really attracted the nursing home to me, is that feeling of space. From my mother's point of view, I think what she likes about the nursing home is that the staff are very kind and very caring. They're very attentive to her needs. Some years ago, she would have loved excitement and lots of things happening and lots of conversation. But as the years have gone on and as her dementia has increased, what she needs is more peace and quiet and a calm atmosphere. And I feel she really very much has got that here in Coralhaven. They accept where she is at, and they accept her limitations. And I think that's very important for her, that they realise that there are a lot of limitations because of her dementia. I come in most Saturdays for the Mass at 3 o'clock, and I sometimes read for Mass, I sometimes do the reading for Mass, and it's a lovely community get together as well as being a lovely Mass. It's a lovely opportunity for the community to get together. I would highly recommend Coralhaven.
I took a stroll on the old long walk today, I met a little girl and I started to talk in a fine soft day, and I asked you, friend, what's a fella to do? 'Cause her hair was black and her eyes are blue. And I knew right then I'd be taking a whirl down the Salt Hill Prom with the Galway girl. We were halfway there when the rains came down. The day I she asked me up to her flat downtown on a fine soft day. And I asked you, friends, what's a fella to do? 'Cause her hair was black and her eyes are blue. So I took her hand and I gave her a twirl. Oh, I lost my heart to a Galway girl.
We in Coralhaven take great pride in the service that we provide. We have an excellent team and we provide a high standard of comfort and nursing care. We would welcome you to come and meet us at Coralhaven and see how we could be of service to you and your family.
When I woke up, I was all alone, with a broken heart and a ticket home. And I ask you, friends, what's a fella to do if her hair was black and her eyes are blue? I've been traveling round, been all over this world, 'cause I ain't never seen nothing like a Galway girl.